So today for the pharmacy chat, we're just going to go through some general information that you should know about the medication and how to take it. So the medication is really any substance that you can take for a therapeutic effect that will help you to one either improve on an illness or a symptom that you may have, or to help prevent a symptom that you may have, or to maintain your health. So things like vitamins, supplements, even bush tea, tablets, syrups, etc., they can all be considered medication. So how should you take your medication? When you do go to the doctor or the pharmacist, or when you go buy an over-the-counter medication, then you will read the instructions that is there. It will indicate how to take it. You can always ask your doctor or pharmacist about how to take it. If it is prescribed medication, then it will be on the label, and the pharmacist will also tell you whether or not you take it one tablet once a day, two tablets, three tablets, etc. So if it is that you are taking, let's say, two tablets three times a day, you will try to get it as evenly spaced out as possible. So you will take, if you monitor it, let's say 6 o'clock in the morning, you will take two tablets, you will take another two tablets at 2 o'clock in the afternoon, and then you'll take another two tablets at 10 o'clock at night. So you try to get it evenly spaced out. So even if it is that you do start to take it, try not to go, okay, well, 7 o'clock in the morning, then 12 o'clock, and then 5 o'clock, and then you're like, okay, well, I've taken all my medication for that day, but you haven't taken medication for the hour between 5 and 7 the next morning, and that's over 12 hours without taking medication. So always try to get your medication as evenly spaced out as possible. Always try to get it around the same time every day. That will help to make sure that the level of medication that's inside your body is at the same level consistently so that your body can get the maximum effect of the medication. So the other thing about taking medication is that you should take it how it is supposed to be taken. So in terms of the tablet, sometimes person may feel uncomfortable taking certain tablets because of the size or they taste bad or you may just not like how it looks. If it is that it is a large tablet, you should really find out if you can crush it or break it because not all medications can be crushed or broken. The shiny ones especially really should not be broken unless you can see like a line through it. That line is called a score. So that really indicates that it can't be broken in half or broken in quarters or broken in a certain number of times as indicated by the number of lines that's on the tablet. Other tablets can be allowed to be crushed or broken, but then there's some that say, take this tablet whole, or take this tablet, do not open this capsule, do not break, do not crush, etc. So this is because a lot of tablets do have a particular time of when it must be released. So if you look up, let's say everybody might know diamicron or glycoside for the blood sugar, it will say glycoside MR 60 milligrams. The MR stands for modified release, which means that they have modified the tablet to release at a particular time and a particular speed to get the maximum effect of the medication for the whole day that you're taking that medication. So for things like that, if you're marked with MR or XR, then you really should not break it. Some of them will have enteric coating like aspirin that is ready to protect the tablet from when it goes into the stomach so it doesn't break down the stomach acid so that when it does go into the ileum or the intestines, when it does get into that area, the acidity in that area is different from the stomach. So once it gets there, it will start to open up the tablet and actually release the medication. So things like aspirin you really should not crush. So if it is that you are taking medications, some medications must be taken at a particular time of the day. Some of them will have to be taken at night. Some of them will have to be taken in the morning. For example, like the American or glycoside, they really should be taken at breakfast time. And you must get some to eat when you take blood sugar tablets. With the microns, that is specifically at breakfast. With something like metformin or glyphormin, those can be taken throughout the day, but you should really still get something to eat. Another tablet a person may take may be something like atorvastatin for cholesterol, or simvastatin, or rosuvastatin. It is usually recommended to take it at night, mainly because most of the cholesterol is made between the hours of 8 p.m. and 1 a.m. So throughout the day, let's say if it's cholesterol is being made at 1 each hour, between the hours of 8 and 1 a.m., 8 p.m. and 1 a.m., the cholesterol goes up from one every hour to 4 times that amount. So if it's at 1 before, it's not making 4 times the amount of cholesterol between 8 p.m. and 1 a.m., which is why it's recommended to take it at night. So things like that will have a specific time frame on when you should take the medication so that it does have the maximal effect or maximal therapy for when the medication is being used. Something else that persons may know is something like prednisolone, which will help to reduce inflammation as well. If persons have like allergic reaction or if they're coughing really badly, etc. So something like prednisolone will indicate two things. Take it during the day and take it with food. With prednisolone, it has two effects that can interfere with the person's body. One will be it will make the person hungry. How that occurs is that it produces some chemicals in the body that stimulates the appetite. The other effect because of that is that it causes the person to stay awake. So because the body is producing these hormones that will cause the person to feel hungry and stay awake, it's recommended you either take it at breakfast or lunch, or a time that you know that you're supposed to be awake. So if you take it at night, or if you give it to a child at night, you will experience that that person will be awake throughout the night. So it would be best to take it when you know that they're going to be awake. In addition to that, you have to give it with food. So with any medication, you really should ask, should I take it with food? Should I take it without food? Should I take it in the morning, the day? There's a time after when I do take it. You will just have to make sure that you get your times on what the parameters of taking medication are correct. A lot of persons may wonder if they should take it with milk, juice, food, or just plain water. So with some medications, you can only take it with water. Other medications, you can take it with juice or food or milk. Some medications is recommended that you do take it with milk to help reduce stomach discomfort. So with things like antibiotics specifically, they're usually done with water only. There's some that you can have something to eat with, and then some that you can only have with water, or some that you can have with milk to reduce stomach discomfort. With like aspirin, cataflam, other pain medications, voltaren, those should be taken with food or it be after a meal or with something like milk because it does cause the stomach to feel upset in addition to producing a lot of acid. So if it is that person's point that they have acid reflux, then they can take it with omeprazole or pantoprazole or something that is used for reducing stomach acid. Even if it is like a Tums or a calcium tablet that will help to soothe the stomach, or if they don't have that, they can just have it after a meal. With things like antibiotics. Antibiotics are very important. What antibiotics do is that they help to treat or kill bacteria and bacteria only. Other things would be like antifungals that will help to treat or kill funguses, and then there are antiparasitics that will help to treat or kill parasites like worms and amoeba, etc. Then there are antivirals. Antivirals are very specific and they will only work with viruses. Antibiotics will only work with bacteria. So if it is that you're taking an antibiotic for the cold, it will not make the cold get better. The cold will last about 7 to 14 days and then it will go away by itself regardless if you take antibiotics or not, unless it is a bacterial infection. With antibiotics, you must specifically ask whether or not you can take it with water or food or milk or vitamins or juice. Because something like amoxicillin or penicillin, where a lot of people are allergic to those, if you do take that with milk or juice or anything containing calcium or magnesium, like the same calcium tablets or Tums or Dica or Pepto-Bismol, because amoxicillin can upset their stomach. If you do take it with those things, they will reduce how much medication your body actually absorbs, which means that the medication will not be as effective and it will not work properly, and it's possible that the infection will not completely go away. If it does not completely go away, it is possible that it can come back, and it can come back worse, and it can become resistant. And if it does become resistant, then it's possible that it becomes extremely difficult to treat, and then it may become costly because we now will have to find medications that will work. So they'll have to test to see if the medication is working on the bacteria to see which medication will work to help kill it. And if they're unable to find it, you may have to get hospitalized, and they may have to get specially authorized drugs to be able to treat those. And as you know, they may be very costly. So how should you store your medication? It depends on what the medication is. Try to make sure that all your medication stays out of the heat and stays out of the light, as well as stay out of children's reaches. As you know, medications can help treat symptoms or illnesses, but they have side effects as well. And if you are taking, let's say, blood pressure medication, that's to help reduce how much work your body is doing for the blood pressure. But if a child gets that and their blood pressure is regular or fine, the child will get sick. So you do not want the child or children to be able to access it, nor pets. So you will try to keep your medication in a cool, dry, and dark area so that the light does not cause it to become destroyed, the heat, nor the water or moisture. Some medications must be stored in the fridge, some eye drops must be stored in the fridge, all antibiotic syrups must be stored in the fridge to help reduce the medication going bad. If it is possible and you have a fridge that you can keep at a regular temperature of about 10 degrees or 8 degrees Celsius, you can put all the medication that you want into the fridge. But if you do that, you must put it in a plastic bag. And if you have like a desiccant, something like one of those little silicone packages, you can put them in there to help keep the medication free from moisture. If you don't have that, you can get cotton wool and put the cotton wool into the bag or the packages, and that will help to reduce the moisture that gets into the bag. But because we live in a hot country and the medication has been formulated for America where it's a lot cooler, then they do have instructions on how to keep it well in America. But we have to remember because of the heat, it can become denatured or destroyed. So we have to try to keep it cool, dry, and out of the light. For a lot of persons, they do take insulin. However, some insulin they're not supposed to take for a specific period of time. At the same time, I also do know that some persons are not allowed more than one or two medication refills per month if it is at the on the drug service team. However, some of the insulin will indicate you cannot take this for more than 6 weeks, you cannot take this for more than 4 weeks, etc. If you do show this to the pharmacist and indicate, they should be able to ask the question to the drug service, and the drug service should be able to assist you with getting the insulin, etc. Try not to take medication that you've had for a very long time without checking the expiration date, as well as if you can take it for a certain number of time after you've opened it. Because some medications cannot be used after you've opened it after a particular time. So let's say if you take an antibiotic like Toberdance, it will say do not use this medication after 2 weeks. It will also say you must keep this medication in the fridge. So if it is that you do have any medication, you really should read the little packet that comes in the box. It will tell you different things in terms of you must store it in the fridge or keep it dry, keep it out of light, or if it's a syrup, or if it's a suspension that you must shake it. So if it is that you do need assistance, you can always call your pharmacy or you call your doctor and ask them about the medication. You should be able to ask your doctor or pharmacist about any questions that you have with your medication because the pharmacists and doctors and nurses are there to assist you with that. Sometimes persons will wonder about other side effects of the medication, whether it will make them sleepy or if it will make them hungry or if someone will be upset or sick and such. A lot of medications can do that, especially antihistamines, things like Pisco. Pisco specifically can make you extremely sleepy. Things for nerve pain, those can also make you sleepy. Any medication that makes you sleepy, you really should not take with other things that can also make you sleepy, whether it be sleep aids or things to help you relax, or other antihistamines, or alcohol, or natural things like teas, like chamomile tea. Because if the medication is going to make you sleepy, and then take something like pistol or diphenhydramine, which is marketed as a sleep aid to help you get to sleep, or melatonin, the effects are going to add up. So one thing is going to make you sleepy, then another thing is going to make you sleepy, and then another thing is going to make you sleepy, and then you're going to get sleepy, and extra sleepy, and extra sleepy, and hopefully you wake up. Alright? So always try to ensure that if you do have something that will make you sleepy, try not to take other things that will make you sleepy, or you can ask to find out whether or not if you can take those things. Sometimes persons don't realize that things like teas can also affect your medication. Fruits can affect your medication. So a lot of persons will want to go to like alternative medicines or complementary medicines or the term would be pharmacognosy, where they're using plants and other natural products to be able to help them with treating, let's say, their diabetes or their blood pressure or a cold or a rash or a cut or a wound where they may have to wash it or take a bush tea or a bush bath. So you really have to be aware of what it is that you're taking. In addition to that, persons who are doing complementary medicines who may not have gone to a medical health professional who knows pharmacology, they may not know how much to take or if it can interact. So you really should ask your doctor or pharmacist or any person who really knows about pharmacology, even a biologist or a botanist, if it is that these things can cause other side effects. So a lot of persons may not know, but breadfruit leaf can actually cause your blood sugar to go down, as well as your blood pressure. But you do not know how much is in each leaf, nor do you know how it will affect your other medication. So if it is a you drink breadfruit leaf tea, it can be beneficial, but you must also be aware and monitor your blood pressure and blood sugar so that you don't lower it too low. Something else like Mabu, especially the Mabu bark, those can lower your blood pressure significantly if you're using the Mabu syrup. It may raise the blood sugar, but it can still lower the blood pressure. So you really should be aware as well if it is that you do have hypertension or diabetes or high blood pressure or high blood sugar, you really should have the machinery to test them regularly, whether it be strips, whether it be a smart watch, whether it be a blood pressure monitor, etc., that you should be able to monitor. Another device that you can get would be a pulse oximeter. What that is a little device that you clip onto your finger, and that measures your pulse as well as the amount of oxygen percentage that's in your body. And if it is that you do have that, as persons are getting older, they might find it a bit difficult to breathe, or if they get sick, they might find it a bit difficult to breathe. And that will help to monitor the oxygen level in your body. If you do have one of those, you should try to not let it go past 92%. If it does go past 90%, then you should go and ask a medical health professional. If you notice that it goes past 75%, 60%, go to the accident and emergency, go to the hospital, go to FMH, seek medical attention urgently, especially if it is that you also have asthma, especially if you have diabetes, especially if you have high blood pressure, especially if you also on cholesterol medications or have a stroke or had a mini stroke or a trans ischemic attack, or if it is that you had a minor heart attack, you must seek medical attention. The other thing to remember is that all medications will be different for persons in terms of how it affects them. However, there is a general thing of the average of how it will work. So while blood pressure medications will try to lower your blood pressure, for some persons it might lower it by like 5 points, other persons might lower it by 10 points. And then if it lowers, let's say, pretty quickly, persons might find that when they stand up, they get dizzy. When they sit down too quickly, they get dizzy. When they sit up too quickly, they get dizzy. If they don't drink enough water, they get dizzy. So we really should, one, not take other people's medication, and two, always let the doctor and pharmacy know if it is that you're having any kind of side effects, because they can monitor it and see how it's affecting you, as well as they help make sure that the medication works best for you. If it is that you do have any kind of side effects, even if it is the ones that they tell you that you're going to get, you can still report it. So what they do is drug monitoring, and that's called pharmacovigilance. So what they do is monitor the medication so that they will have an idea of how frequent this can occur, how common is it, how many persons it might affect, what ethnicity of the person that it might affect. So with those things, some medications may affect women more, they may affect men more, sometimes it may affect both persons, sometimes it will affect a different ethnicity more. Some medications affect Asians more, some medications affect black people more, even some of the blood pressure medications, while they work really good for a lot of other people outside of the Caribbean or outside of the African diaspora, even Africans and other black people outside of the African diaspora, in the African diaspora specifically, because of all the trauma that has occurred, it has ingrained in the person's DNA, so it becomes a little bit more difficult to treat. So we will see that there's a lot of diabetes and hypertension in the Caribbean and the Americas, because our bodies have become a little bit more resistant because of the trauma that it has gone through. So genetically, some medications will not work properly or work as it is supposed to from based on the clinical trials because of the ethnicity and the genes or the genetics of the person. So if it is that persons do have side effects, they really should report it. They can go to the Barbados Drug Service website and report it, or they can also tell their doctor or pharmacist or nurse or medical health professional, and they should be able to report it for you. Then they just have to record some information as in what the, let me just pull up the information that you're supposed to record. You may have to record some information as the type of medication it is, what the lot number is or what the batch is that it has been in, include the gender, age, and initials of the person. They should also identify the person that's reporting it. So if it is that they need extra information, that they can go back to the person and say, okay, well, I need you to get more information from this patient. You can also indicate the brand name. Let's say Diamicron, although Diamicron isn't the brand anymore. Let's say Diamicron, they include the generic name, which would be the glycoside, and you include the batch number or the lot number, which is the batch that is made in. And then you will describe as best as you can what effects that you're getting, whether it be an allergic reaction, whether it be a headache, whether it be that you're staying awake or you're falling asleep or that it hurts your stomach. So you should really report all side effects that you have. As a general rule, you really should not take alcohol with any medication. There are some medications that will severely dehydrate you with alcohol. There are some medications that will cause you to fall asleep with alcohol. There are other medications that will cause you to have extreme vomiting, seizures, and fevers with alcohol, and potentially you might die. So with alcohol, it can become very dangerous with that medication. That medication specifically is something called metronidazole, which is an antibiotic, antiparasitic medication. It can cause severe upset stomach, and you should have it with something to eat, but you cannot take alcohol with that medication. You cannot have a drink, let's say that you're going to the bar or friends or event or party or celebration with let's say if you take the medication in the morning, you feel it's okay to take it on the evening. No, you cannot take that medication with alcohol for at least 2 weeks after you finish that medication. Metronidazole, Metro, Metro, 9 Nidazole. And it's an antibiotic or an antiparasitic, so it helps to treat infections. With any medication, unless it is that you are having kidney issues, because if you're having kidney issues, they will tell you you have to take this certain amount of water every day. But with any medication, you should take it with a full glass of water because it will dehydrate you. You might get a headache, you might notice that your vision gets blurry, or you may feel a little bit weak, or hot, or tired. You must take it with water. You will notice some medications will also cause the urine to go a little bit bright or a little bit darker. That's really your body indicating that it's helping to get rid of the medication and that it's working properly. So if it does do that, you should not be too worried about it because it indicates that your body is working well. If you find that you have not urinated or gone to the bathroom for 6 hours or more, then you should be worried and you should go to the doctor. That usually indicates a minor kidney injury that has occurred, whether it be that the kidneys have become inflamed or it has become swollen and it's reducing the swelling. Until it's able to do that, when something has swollen up, let's say if the kidneys have a hole and it's swollen up, the hole will get smaller, so it becomes more difficult to urinate, and then when the swelling goes down, it will open back. So if it is that you find that you're not urinating for 6 hours or more, you should go to the doctor. If you're not urinating for 12 hours or more, you need to seek urgent medical assistance. On the basis of urination, anytime that you feel that you have to urinate, you should go to the bathroom as soon as you do. The reason for that is holding your urine can cause urinary tract infections. In addition to that, some medications will work by causing you to go to the bathroom. Some diabetes medications do that, some anti-inflammatory medications do that, some blood pressure medications do that, some antibiotics do that. So you must go to the bathroom. One, for the medication to work properly. Two, because holding your urine can cause urinary tract infections, and then they will become a little bit more difficult to treat because you don't have to take antibiotics in addition to trying to flush it out. And if you're holding your urine, they can reoccur quite frequently. The other reason for why you should urinate, especially if you're on medication, is that it is your body's way of getting rid of the medication. So once it's able to get rid of medication, it's not going to build up in your body. You will not get, or the side effects will be reduced so that you will not get certain side effects. So let's say if you are taking a blood pressure medication and you do not go to the bathroom, or you have not gone for a while, and medication builds up in your body, you'll find that when you stand up, you'll get really dizzy. Some persons might fall down. If it is that their blood sugar medication You'll find that when you wake up in the morning, you test your blood sugar, it might be really low, or you might feel like you're getting lightheaded and you need to get a sweet or a drink to bring back up your sugar, but you really should test it first. So all these things of using your body properly will help the medication to work best for you, like drinking a glass of water, going to the bathroom as soon as you do feel to go to the bathroom. In terms of some cough syrups that will help to bring up the mucuses on the chest, once you take it, extended ammonia, pistol expectorant, or any kind of expectorant, you can drink a glass of water because the water will help to soften the mucus in addition to the medication will help to break it up so that you can cough it up easier, so that it becomes less painful to cough. In addition to that, it helps to get rid of it a little bit more. So the main point of all this is whenever you're taking any medication, drink plenty of water, but also go to the bathroom unless you're having kidney issues, then you should really follow the amount of water that the doctor has prescribed that you must drink. But if it is that he's prescribed that, you can still drink that water with the medication. Just make sure that it's within the amount of water that the doctor has told you to drink. Another set of medications will be something like eye drops. A lot of persons will be on medications to help reduce the pressure in the eyes, for the glaucoma, for an infection in the eye. A lot of eye drops will require you to keep it in the fridge. Some of them don't require you to keep it in the fridge. However, they can still last in the fridge. So you can put all your eye drops in the fridge if you need to, especially because Barbados is hot and eye drops really should not go above 24 degrees Celsius. And on any regular day, outside it's about 27 to 30. So you can keep your eye drops in the fridge unless it is that you have it in your air conditioning room. And not many persons may not necessarily have it in your conditioning room, so you can put all your eye drops in the fridge. When you are using eye drops, you must first wash your hands to ensure that they're clean, and then you take off the cover. Make sure that nothing touches the inside or the bottom of the cover. Make sure that nothing touches the dropper. If something does touch the dropper, it's possible to put an infection into the eye. So make sure that you wash your hands first, and then make sure that nothing touches the dropper when you do take it off. And when you do put in the eye drops, you can either pull down the lid and put it in the lid, or you can pull it up, or you can ask somebody to assist you with it. If you have to put in more than one eye drop at a time, you can put in one drop in the eye and then wait about 2 to 5 minutes to allow that medication to go into the eye before putting in another drop. This is to allow for the medication to remain in the eye so that it doesn't wash out the eye. Because if it does wash out, the medication won't work because it's no longer in the eye. In addition to that, when you're finished with it, try to ensure that nothing does touch the dropper and you can screw it back on and put it back into the fridge. As I mentioned before, some eye drops will indicate that you cannot use it after the time period has gone once you started to use it. Antibiotics are especially like that, whether it be syrups, suspensions, or eye drops, they will indicate do not use after 2 weeks. And this is to help prevent things from growing in the antibiotics because things can become resistant to the medication. Once you have broken the seal, it's possible that a bacteria or a microbe can grow in the medication. So try not to use it for longer than is indicated that you should use it for, or try not to use it at another time period. Let's say you had an infection in February and you use it at the beginning of February and it went away, but then you got infection in the middle of March. You say, well, I got these eye drops at home. You can't do that. You need to go and get a fresh set of eye drops because you don't know how clean or sterile those eye drops are anymore because you've already opened it and had it there for longer than the time period that you should use it for, and then you want to go and use that, put that back into your eye. Another thing that a lot of persons use is inhalers. So if persons are using inhalers, depending on what type of inhaler it is, let's say it's an asthma inhaler for Ventolin, you must shake it first to ensure that the medication mixes well and is a consistent concentration throughout the whole medication. When you use it, the first time that you use it, you give it a couple pumps until you see the spray comes out. Once you know that the spray is coming out, you know that the mechanism or the device is working properly, and then you will put it into your mouth and you will take a deep but consistent breath. Do not gasp it. So you will just breathe in consistently but deep, so that the medication actually goes into the body and into the lungs where it needs to be. If you gasp it, it will hit the back of the throat and it will stay there, and you might find that you get some stinging at the back of the throat because the medication has not gone where it's supposed to be, and so it's not going to be effective. Another type of inhaler would be the nasal sprays. So when you do the same priming, which is pumping it up, you see the mist comes out, then you will point it to the back of the nose, slightly off center, and then you will inhale like normal, just deep. Try not to gasp it again because it will not be effective. So when you do that, inhale deep, then you can hold for like 2, 3 seconds, and then you can exhale. For some of the medications, for the inhalers, especially for the asthma, if you have to use the asthma inhaler every day, some of them will contain steroids in them that will help to reduce having an asthma attack. You should always wash out your mouth afterwards. Otherwise, person may notice that there's a white film in their mouth after a while, and what that is a fungal infection beginning to occur. So you should always wash out your mouth afterwards of using some of the inhalers. Things like Remington doesn't necessarily mean that you have to wash it out. But things like Serotype, Decotype, um, anything that contains a steroid, they usually end in Z or I, budesonide. Those things will need you to wash your mouth afterwards. One of the most important things that you can do for yourself and your medical team, because you're all going to be a team assisting you in making sure that your health is well, is learning your names of your medication, learning how much you take, learning how frequently you take it, and learning the strength of the medication. Because there are a lot of tablets that are wrong and white. So when you say, I take a little white tablet, I could give you a list, a little white tablets. I will not know, and they will all be for the blood pressure. They will all be for the blood sugar. Or you say a little white, a little tablet, a little yellow tablet. Some medications are a little bit more specific, something like bisoprolol or Concar, where they're heart shaped. So you will know, okay, well, if it's heart shaped, it's a high possibility that it might be this one. However, there's still quite a few heart shaped tablets. So learn the names of the medication. If you don't know the names, take a picture and store it on your phone. Take a picture and store it on your tablet. Write it down in a booklet. Write it on a piece of paper. Put it in your wallet or purse. So you always know that you have your list of medications with you. The other thing is, learn what your medication looks like. Sometimes when you go into that medication, it might not have a particular brand that you usually get. The medication might change, or it might look different, or it might get a different name, or a different brand, or it might get a different color, etc. But still try to learn what the name is, and try to learn what it looks like. So if you get something that you know, let's say it's glycoside. Glycoside hardly ever changes, and it usually looks the same. It's an oval tablet, it has the A on one side, 60, and then it has a line or a score through it in case that can be broken. And it's a white tablet, an oval tablet. That glycoside usually looks the same if it's glycoside MR, and it will usually be what the medication is that people will be able to recognize for the blood sugar because it's the main one that person will be using. So that one is fairly okay to go, okay, well, I know that this looks like this. However, at the same time, there's still potential for us to bring in other generic brand. So try to know what the medication looks like. So you can say, well, I don't know what this medication is. I don't know what this looks like. I don't know. You can ask the pharmacist or the doctor. Please let me know what this medication is for, and let me know how I'm supposed to take it, or give an answer how it works. In addition to that, a lot of persons will try to get a pill container because it will help them to try to remember what the medication is. Learning what your medication looks like and learning the names of medication will let you know, in addition to what it's for, which medications they are. So if somebody has a weak pill container and they start to put it out in their days and they don't know what the medication is, but they put it out, they know they take it. If you miss a dose, or if somebody comes in and says, okay, well, let's say a caregiver or somebody, they come to give you medication, they don't know what is in that container. If somebody calls emergency services, if you're unconscious about your kids is, they also don't know what that medication is unless they're familiar with that medication. So they can't necessarily tell you what that medication is in the pill container, what you took, or when you last took that one. If you're finding difficulty with knowing when to take medication, almost everybody has a phone. They can set an alarm at the times that they should take their medication and try to get the medication at the same time every day. If you do miss the dose, take it as soon as you can, unless it is close to the time that you're supposed to take the next set. So if it's within about 4 to 6 hours of when you're supposed to take the next set of medication, only take one set of medication. If that is that you're taking it once a day. If it is something like paracetamol that you're taking every 4 to 6 hours, if it is that you're on that particular dose, then you can take it, let's say if you forget at the 8th hour, you can still take it at the 8th hour and then take another set 4 hours later. But if it is that you're taking something like bisoprolol, which is once a day, and you forget to take it at 8 o'clock one morning, but then you remember because you got up early or late one night and you take it at 1 o'clock in the morning, just wait till the next morning to take that medication. Or if you get up at 6 o'clock in the morning and you take one at 6 o'clock because you forget and you want to take one at 10 o'clock, no, only take one set of medication. So, one of the major topics around the world right now, and has been for a while, the last 10 to 20 years, is antibiotics. Antibiotics are very useful. However, they can become very unuseful very quickly. Antibiotics help to kill bacteria and only bacteria. When they're used incorrectly, they will not work, and the bacteria can learn the medication and learn how not to be killed by that medication, which means the medication will not work. So if it is that you're on antibiotics, always let the doctor pharmacist know that one, if the antibiotic is working, two, if you're allergic to the antibiotic, and three, if you are taking it, take it exactly as it is prescribed. If you have to take it with food, take it with food. If you have to take it with water only, take it with water only. If you have to take it with milk juice, or if you must not take it with milk or juice, do not take it with milk or juice. If you do not have to take it with milk or juice, you can wait 2 hours before or 2 hours after if you want to get milk or juice. And ensure that if you do not have any severe side effects or allergic reaction, make sure to take all of the medication until it is completed for the time frame that you're supposed to take it for and how you're supposed to take it. If you stop early, so let's say augmented, you might feel better around day 3 or 4, but you have a 7-day course. You will take medication tomorrow, you forget, or you want to stop taking it because you feel better, you don't feel it anymore. In about 2 weeks or so, it's possible it can come back. It's possible it can come back worse. It's possible it can become resistant, and so the medication won't work because the bacteria learn how the medication works and learn how to not be killed by the medication. So try to complete the full course of the medication for the antibiotics. In addition to that, do not share the antibiotics with anybody because you've gotten a certain number of tablets or certain etc. to treat the infection for a certain number of time to help kill the bacteria or the infection. So that will be enough medication for that one person for that time frame that they should take it. Another set of medication that person will usually take would be diabetes medication. Majority of all the tablets for diabetes, you must get something to eat. With majority of the insulin, you really should get something to eat. Unless it's a long-acting insulin like Lantus, you don't necessarily have to get something to eat with it. But all the rest of the medications, you must, otherwise you will start to feel lightheaded, dizzy, your heart will start to beat fast, you will start to feel jittery, you will start to feel restless, your legs will start to shake, you will feel you have to move, and you will start to feel lightheaded, weak, and if you are going to pass out, that's your body indicating you must get something. With hypertension medication, the person will notice that if it is coming to the time that they should take their medication, their heart will start to beat fast, or they might feel restless or jittery or feel energetic. And that's really because the medication is wearing off and is indicating that you should take your medication. The mentioned cholesterol medication is best taken at night. You will avoid grapefruit products with majority of cholesterol medication, and any medication that is indicated you should not take grapefruit with. Grapefruit can affect a lot of medications. In addition to that, there are a couple of other fruits that affect a lot of medications because it affects how they are broken down in the body. Sometimes some medications are activated in the body. So grapefruit, do not eat grapefruit or grapefruit products when you are taking medications or any medication. Passion fruit. Passion fruit can also do the same thing as that. Kiwi, lychee. While those fruits aren't as common in Barbados, they can also affect the medication. Kiwi and lychee, passion fruit, and grapefruit. Another two popular ones is star fruit or carambola and pineapple. Pineapple seems to be the strongest one that can affect it. 5% of the active ingredient in pineapple can deactivate 100% of the medication. So, pardon me? It can be a various number of medications. It could be some antibiotics, it could be some cholesterol medications, majority of cholesterol medication. It could be things like tamsulosin, it could be some blood pressure medication, it can be some other medication in terms of lupus, arthritis, pain, etc.
How do you know that? For example, pineapple is a pain medication. The same thing can most often enough. Dogs will tell you about grapefruit. But no one has ever told you about pineapple.
Any medication
Any of those.
any medication that they tell you about grapefruit, do not use those other fruits.
Really?
That is perhaps because, like you said, in this case, for America, and America doesn't know anything about pineapple and kiwi.
Well, it's not correct. It's not based on that. What happens is, does everybody know what enzymes are? So when you eat food and goes into your stomach, there's stomach acid and other proteins that will break down the food. That also has to break down the medication so the medication can be absorbed. And in your body, the liver helps to break down or metabolize or activate or help to get rid of some of the medication. If you take grapefruit, pineapple, etc., they can stop that process from happening. And if it is activated in the body, it will not work. The medication will not work. If it is broken down in the body, the medication will build up in the body and you will get side effects. You want to know, well, I was taking the medication and it was working, and now I feel sick. Now I can't move. I feel like I can't get up. The blood pressure gone from 140 to 120 to now to 80 and 60 because the medication has built up in the body and the fruits have stopped the process for the breaking down of the medication. So with those medications, you really should not take those fruits. Any medication that the doctor or the pharmacist indicated that it has, that you cannot take grapefruit, do not take any of those other fruits. You can also look at your medication and find out, let's say, clopidogrel for anti-clotting or preventive platelets so you don't get blood clots or help prevent heart attacks and strokes. If you look up clopidogrel and look up grapefruit, it will say do not take grapefruit with clopidogrel. That also means do not take pineapple with clopidogrel. Do not take passion fruit with clopidogrel. Do not take star fruit with clopidogrel.
Excuse me, Brother Remington. I have a question. Based on all you've said today, I'm surprised that I'm living, and from the response, I think a lot of other people are surprised. Now, I have a question. You said something when you started earlier about the release in medication, if it's too big or whatever, for the time release. I can't remember the exact term you used, but like the time. Yes, thank you. For years, I don't like taking medication. I just take my blood pressure one because I have no choice. But like capsules, I always open them and take them. And my sister says, but I don't think you're supposed to do that. And I have done that my entire life. And even the eye drops you spoke about, I buy eye drops and I use them for the period and then I don't use them and it's sitting on my dresser and then I take it up and I use it again. And you just said you put them in the refrigerator. I am not embarrassed, but I know from the response a lot of others here are doing the same thing. So I mean, no, so I do thank you for saying these things, and that's why we thought that it was important to have a chat with the pharmacists because there are things whereby we are slowly killing ourselves and we are not aware because I cut up every, that is very true. And then my doctor says, but why do you still have that cough? The antibiotic should have worked, and I pumped up every tablet I have.
There's some tablets that you can crush, and there's some that you can't open.
I know you said the one with the score, but they don't always have score. I always say to my doctor, but you keep giving me these bulldog tablets. Can I get this in a liquid form? He said, you're not a child.
So, well, one thing, so with that particular one, look on the box. It will say, swallow whole, do not crush or chew. You will know exactly which one you should not do that with. Do not open capsule, do not break, do not
But
burst.
I am glad that you said that because why is it that the pharmacist tends to put the label with the directions over the instructions?
And it's so small. You can't read it. How could you tell you cannot read it even with a magnifying glass?
Majority of medication have a pamphlet in the
You
box.
can't read that.
So if there is a you find difficulty with that, ask the pharmacist. However, when I do the on labels, I always try to look for a blank area to stick the label onto. You can also tell your pharmacist, please stick it on the part that says, because a lot of medications say, put label here, or put it at the back. You can ask them, please stick it at the back so that you can read what's on the thing. So even in like the US or America or even the UK, by law they have to have it clear in addition to including the booklet or pamphlet. So based on the time, I'm just going to try to wrap up pretty quickly. I just have one other point, and then we can take a couple questions before we do have to wrap up. In terms of ointments, powders, creams, always try to make sure that the area is clean and dry. So wash it and dry it before applying those. In addition to that, if you have to put on a cream with an ointment, put on the cream first because the cream is water based, and then put on the ointment afterwards because the ointment is oily. If you put on the ointment first, the cream isn't going to be able to penetrate past the ointment. When you're putting those on, try not to rub it on if you're as if you're creaming your skin because the medication is in the cream. So when you rub it on and rub it on and rub it on, the medication is going to stick on your hand, you will wash your hands, and that's the medication that will be sick. With the powders, you can still apply the powder. Yes.
Um, in relation to penicillin, what is the great danger that every doctor or pharmacist all the doctors are allergic to it? What is the basic of penicillin
So, with penicillin, a lot of persons have allergies to it. And it's due in part to the sulfur, but it can also be allergic to any other part of the molecule. And what happens is, if somebody is severely allergic, other than allergic reactions are very painful. Because I was allergic to a supplement, my face swelled up one morning, and I felt like I was punching my face over and over and over. And that was a mild allergic reaction. When other persons get allergic reactions, their face, their tongue, their hands, everywhere swells up. They get rashes, they get hives, their skin starts to have swollen areas. It becomes very painful to touch. And with the more severe cases, when their tongue and throat swells up, their area is blocked off and they can no longer breathe. When they're noticed that they're having an allergic reaction, you can take one histone pole, crush the next pistol, put it under your tongue, and get emergency services. If you do have to go to emergency services, you can call the ambulance. If you cannot get through the ambulance, you can take the person. However, call the police so that they can escort you to the hospital. That way, they'll be able to clear the traffic and you'll still be able to get there in time if an ambulance is unavailable. If it is that persons are allergic to something and they know they may have allergies to like nuts or peanuts or shellfish, they really should walk with an EpiPen, check the expiration date of the EpiPen, know how to administer the EpiPen, and teach somebody else how to do it. I remember seeing a video where a guy was allergic to bees, and he had a 3-year-old child. How he explained it was he had honey fever. And when the bee stung him, he had an allergic reaction. He passed out. The child called 911, and the child was able to explain, my daddy had honey fever. And he went, buzz, and they recognized that he was allergic to bees. And because he had taught the child how to administer the epinephrine or the adrenaline or the EpiPen, he was able to revive his father, and his father was able to get medical attention. Any other questions?
I just wanted to make
One second, she can pop her hand up, and then I'll be able to answer your question. Any other questions? Otherwise, this may be the last set of questions.
Um, I take tablets for medication for restaurant. I can't remember what the name, but I was taking it
Does it
for.
begin with an A?
Pardon?
Does it begin with an A?
Yes,
Mhm.
yes. And I was taking it for what? Well, I had to get a problem in my eyes. And I went to see the doctor. And he informed me that the back of my head, that's why it was bleeding. And the cholesterol tablets kill the nerves and eye. And after they tell me so, I don't know if it's right or wrong to do it. But when they tell me that, I've been taking them every night then. I take them 3 times a week instead of every night. I do that. Anyhow, I went back and I tell him what to do. He asked me if I notified the doctor. I said no.
You really should.
I didn't notify the doctor because I feel that taking them every night and it damaged my eyes, I should not take the dinner like that in my. So anyhow, after I get the release, then the eyes had pressure, real bad. And I was taking a drop for this pressure. And all right now, I still in taking them every night. I was just scared of taking them every night because the doctor said damage the nerve in the eye. I did wrong, all right.
So, 2 things. You are correct and wrong at the same time. One, if it is that you're having severe side effects that can be quite debilitating and increase your quality of life, you can let the doctor know. Any medication that affects you, you have the right to refuse the treatment. You have the right to let the doctor know this is what is happening. You must tell the doctor this is what is happening. If you stop taking medication, you have to let doctor know, I have stopped taking this medication. Explain why, and the doctor will be able to help assist you with getting therapy or treatment, or the pharmacist or the nurse, so that they can help make the medication work for you.
Thank you.
Right? So when that happens, the doctor will say, okay, well, let me check your cholesterol levels. You might have to take half a tablet once a night, half a tablet every other night, or sometimes some persons may take one tablet on Tuesday, one tablet on Friday, and that's it. But you have to let the doctor know. In addition to, they will be monitoring your blood cholesterol levels so that they can see how it is affecting you. With cholesterol, it can have those effects. In addition to, it can cause muscle pain, especially in the upper areas by the shoulders. What you can do to help with those muscle pains is by a fiber therapy. One of those milk fibers you mix with a glass of water, then you fiber, methylbutyl, fiber therapy, etc. And drink that with a full glass of water. It will not only help with the bowel movement, it will help with the cholesterol, it will help with the blood pressure, it will help to protect the heart, it will help to protect the brain, and it will help to lower the blood sugar. However, if you do take fiber, you cannot take it at the same time as the medications. Because what the fiber does, it creates something that looks like a jello, and it helps to extract the cholesterol and sugars and everything out the body. When it does that, it can do that to the medication as well. One question here, and then the last question. Anybody has any other questions after her?
I really have a comment. I want to thank you for mentioning Marie and bread beans because I'm totally reminded, especially since I returned back to Barbados, the leaves of the tree are for the healing of the nation. And I'm in a church, and I can say that. Because we forget that, but we live in the biggest pharmaceutical place, and that is the
So, majority of medications come from natural products. How they find the medications? They realize which is like very important. One, talk to the older generations, talk to herbalists, talk to the rascals, so that we can figure out, well, I know that they use this here for this here. Let's see what is in this here that we can use to help make other people better. Sometimes it might not be at the concentration that will cause it to work, or it might be at too high of a concentration that causes side effects that may not allow the person to use it. So when they're able to do that, they're able to check and say, okay, well, this is what it is, we can help with this. With using natural products, unless you're able to test and see how much it is that is in there, or you have an idea, then you may not necessarily be able to use it as effectively. In addition to that, every leaf is different. Where it grows is different. The type of soil it is different, and the type of molecules that the trees absorb and make is also different depending on where it is. So with like cotton in Barbados is the best cotton in the world, and they've tried to grow in other places. However, it can only grow as good as it does in Barbados because of our climate and soil.
One last question. Persons have been using and taking a lot of turmeric. And I've heard someone say that when you're taking cholesterol medication, turmeric is not good to take over again. Is there any evidence?
I have heard that briefly, but I have not checked it out in depth. But if you're on cholesterol medication and or any medication for that matter, and you have to take something you think it might not be, you can always ask the pharmacist, ask the doctor, look it up online, as well as assist them with it. I can look up that information for you and get back to you about it. In addition to that, if it is that you are taking it, try to get it spaced out at least 6 hours apart. Some things like okras with metformin or glyformin, try to get those 6 hours apart. Fiber with any medications, try to get those 6 hours apart. So while okras may be good for blood sugar and blood pressure, they can also trap the medication in the juices that it does produce when you cook it, and that can be removed out the body, same way that the fiber can. All right, we have a question over here. Good morning. for persons who have, it depends on what the anxiety is. If it is, there are some medications that have been recalled because they can affect the heart that way and it becomes dangerous, where it creates another arrhythmia, and because it affects how the heart beats, it can affect the circulation in the body as well as stop the muscle from working properly. And when someone has a heart attack, it's like you're having a cramp in your heart, or you have a cramp in your leg or your ribs when you laugh too much or run too heavy, and you try to really get it out. That cramp is extremely painful, but you're able to stretch it out. You cannot stretch out the heart. There's no way for you to stretch the muscle in the heart to get out that cramp. So imagine having a cramp in the heart. So if it is that you're on medication, some antihistamines will prolong the QT signal. And because of that, persons should really let their doctor know, let their pharmacist know, even if it's going for over-the-counter medication, that they have this issue, so that it does not cause severe issues in terms of the heart. You were given one? Uh-huh. Mhm. Are you also on blood pressure medication? So, which is also why it's very important when you go to a pharmacy or a doctor, to let them know all of your medications, write it down. Alright, you may want to come to my pharmacy. So with some medications, you cannot take certain cough syrups or antihistamines because they can increase the blood pressure, cause the heart to beat fast. So that when people take um, Ventolin, the other side effects that it causes the heart to beat fast, increasing blood pressure. That can also happen with some antihistamines, especially decongestants, especially things that will open up the airways, things that contain chlorphenicin, things that may contain menthol, things that may contain things that are expectorants and decongestant. They will cause the airways to open up because the receptors are in the body are activated, but those same receptors are also on the heart because the heart and the lungs work together to pump blood around the body. So when that happens, it can increase the blood pressure. So we really shouldn't take some antihistamines, depending on which one it is, with other medications. In addition to that, other ones can also slow it down as well. So you should really be careful. You're welcome. As we don't have any more questions at the moment, I will thank you for your attention. If you have any other questions, you can always let them know. We will see if we can get a part two or a pharmacy chat session that you can be able to get your questions answered as well as go through the other list of my general information that you should know.
Can we please put our hands together and give downtown a wonderful round of applause? I want to say thank you. Thank you for sharing your expertise and your knowledge with us. We are very proud of you. You're a young Barbadian. Yes, we're proud of you. And you went to one of the schools. Yeah, from, okay, I call your names. Yes, and for those of you who want to know which pharmacy he's at, Britain's Hill Dispensary. That's correct. Right. So I'm very proud to know that you take particular interest in the patients who come to see you and giving them the advice that is necessary to save their lives. And this is the advice that we have had today life-changing advice because I didn't know all the things about grapefruit and how impactful that could be, leading to death, and all the other fruits like passion fruit, carambola, star fruit, lychee, and pineapple, and kiwi. Those are things that we love. So we have learned a lot today. I just have one question or maybe two. First person to answer, May can first. May. What was the name of the local fruit that Mr. Ford mentioned that could be used to help bring down your blood pressure? Breadfruit leaf. Yes, ma'am.
Give me your praise.
You're most welcome. And I think I can do another one. I'm going to give you a hard one this time. This is something that you can put on your finger to measure your pulse. What is it?
Oximeter, oximeter.
Oximeter.
I have one.
Y'all want another question?
Yes.
You want another question? I didn't hear that one. Oh, that's the other black bag. All right, that's ready for another one. Um, what is the name of the medication if taken with alcohol can cause death? It begins with M.
Something Zool. That's a something Zool. That's a something Zool.
Electro.
Zool. Zool.
Thank you. And yes, here right over here, a book called God Understands Very Few of Love. Good. Thank you so much, ladies and gentlemen. Thank you so much, Mr. Anthony Ford.